This is Arua Regional Referral Hospital. It serves a large catchment area and quite often faces a patient overflow. The effects are negatively affecting the populace.
They are very harsh on patients. They can even mean to slap someone who is in pain.
There are claims of extortion, harsh treatment, and negligence of health workers.
And they normally tell us that government things are for free. But when you go there, you don't get them for free. If you don't pay, they don't work on your person.
It is incumbent upon you to move with some money.
Accounting officers are on the spot.
But I want to warn you to stop. Now I have come and sounded a warning. Next time it's going to be different. Have you heard?
A year cannot go without Karamoja being associated with corruption.
There is a public outcry of desperate patients in West Nile and elsewhere in Uganda over extortion and illegal fees charged in public health facilities.
You want me to go in your face?
In this maternity ward is a cocktail of emotion, joyous and miserable moments from new and expectant mothers as they deal with the harsh realities of extortion and negligence.
It took me like 1.5 days for them to attend me after paying for them 20,000 shillings.
This is Onzima, not his real name. He and his wife have just welcomed a new band of joy. It is a baby girl. Both mother and baby are fine. But the testimony of the delivery room is a close call to her deathbed.
You have to bribe for the life. It's not only with me, it's with most of them. If you don't have money, you will have to suffer and wait for your own time there. That's what I witnessed. And also, when you are going for operation, they will ask for money. You have to give them another 20K for them to do the job very well. If they will ask for that soap, if there is no money, they will finish the operation. After finishing the operation, they will fix goes inside again, and automatically it will start worsening. When they like discharge you, it will start worsening again at home.
Onzima claims that midwives here didn't attend to his wife for a long time as she languished with labor pains. He had to pay in some money so as to get the medical workers' attention to her wife.
Their challenge is only the money. Though they are paid for what they are doing, they still need more and more money.
This experience is not unique to him. A few months ago, this mother that we will call Charity had a similar experience of negligence and extortion from this same hospital. She lives within the outskirts of Alua City. We listen to her story.
I
gave them the money before delivery when I was in labor pain. They gave me the medicine I took. Then after that, the nurse came back, asked for money. I gave her 10,000. Then after that, she disappeared.
Her narrative only paints how worse the situation is at this hospital. She claims to have paid off a nurse so as to get medicines to induce her into labor pains, but this didn't save her the negligence of the health personnel. She was left by herself on the delivery bed, and it's only well-wishers who helped her deliver her baby.
So the nurse was just standing next to the table. Then from nowhere she came and slapped me.
Across the West Nile, there are multiple complaints against medical workers from patients of extortion, absenteeism, and negligence. Most of these complaints have gotten onto the desk of the Inspector General of Government. The Deputy IGG has paid an impromptu visit to Silio Health Center 3 in Telego District. We tag along. In here, it's an absolute failure of health management. The unsuspecting mothers here are asked for a fee of 5,000 shillings for mama kits.
Now, when they pay you mama kits 5,000, what does it do for you? What does it do for you? It's not enough for you to, deny in my face that it's not true, not true. You know that it is true, but what does the 5,000 do for you?
The IGG put these medical workers on the spot over allegations of extortion for a service that is catered for by the government.
When are you supposed to give mama kids?
We give those items which are
What's the
used
money
fast.
they gave you?
They didn't give me money, you can inquire from them.
I don't want to inquire from them intentionally, but I've already inquired in my own. You want me to inquire in your face?
Yeah, I didn't get money from anyone here.
Mama kits are issued free of charge at all government hospitals to pregnant women during antenatal care attendance. However, shameless medical workers are selling off these kits to vulnerable and unsuspecting mothers.
Really? See a mother in pain who does not have money and you still must extort from them for services that are free.
Services are for free. It's just lip service. Medical workers here do not subscribe to this analogy. We return to Arua Regional Referral Hospital, and the reason is to do the simplest of a test to this analogy. We team up with an undercover patient who is tired of extortion at government hospitals. We walk the journey of extortion firsthand with him. We have changed his name. Let's call him Tuku. A few months ago, he was involved in a motorcycle accident and he had to pay money to get an ultra scan at a Jumani hospital.
And I personally paid 35,000 to do the US scanning. So I relaxed for some time, thinking that it was already over with me. I did not do another medical checkup again until I came this side to Arua. Now when I reached Arua, I stayed for 6 months and I was so normal, nothing happened with my body. But 2 weeks ago I felt some pain.
He's now at Arua Referral Hospital to seek medical attention over the persistent pain. Right at the entrance of the hospital is the first red flag. Here, a vendor is seated strategically at the gate selling exercise books. The book is the first requirement by the hospital for patient registration. Everyone has to pay 1,000 shillings, and so Tuku goes through the same orientation. He walks into the queue to get his data registered. The patients are many, so the waiting will be long. Eventually, Tuku is attended to, but as he waits to be registered and meet a doctor, he notices something.
Since the line was too long, I didn't want to wait for a longer period of time. So I decided to ask the person at the reception to help me to fasten up my process of working. He said, this is Uganda, and as we're in Uganda, I know the normal procedures. So to my understanding, maybe perhaps he needed a bribe or a token or something. I didn't know. I was not understanding properly. I asked him critically what was trying to mean. Then that's the time when he told me if I really want to get treatment faster, I needed to bribe my way through. He just said, this is Uganda.
Tuku paid, and indeed he received exclusive service. He was exempted from the long wait and walked straight to the doctor's waiting area.
I paid him money, which money I don't really understand what I paid for. But after some time he tried to help me. He said, in fact my book was brought up in a mention after like around 10 books. Then they sent me to see the doctor.
Extortion is happening here in the manner you can least ever imagine.
The time frame of treatment, they virtually attend to only mostly emergency cases. When it is an emergency, they can help you, but when they help you, you also need to have something in the pocket. If it's not there, generally, we are not being serviced very properly, because people ask money from the cleaners, from the what, to the top management, and Virtually, if you don't have money in Uganda, you are a dead person.
This is extreme decadence from the medical workers who have turned into extortionists from the sick Ugandans. This habit seems far from over. We take you back to Onzima, the father we met earlier. He reveals something integral in this investigation. Workers here have coded different names and words to indirectly ask for money from patients.
Okay, they will not come direct to you. If you are forcing yourself for them to attend you, they'll just say, "Do you have soap for me?
We will listen in again.
Do you have soap for me? Do you have soap for me? Do you have soap for me?"
The word is soap. It's the language medical workers here are using to extort money from unsuspecting patients. The hospital administration is cognizant of these allegations, and they claim they have systems designed to address them.
We have been able to ensure that, yes, there is access to the different levels of administration in the event that a client, a patient, or their caregiver has concerns. These are in multiple prongs. One is what I mentioned, that the numbers of the leadership, the institutional leadership is available to be reached for concern. The office of the hospital director is also open, and a person can walk in and present any verbal concern or written concern, and we have often received some that we have used to follow up and verify and look into the concerns.
More needs to be done beyond providing phone contacts. We walk out of a rural referral hospital with more questions than the answers given. We catch up with a women group that is carrying out community sensitization on health rights to counter poor treatment and poor public service delivery.
We now need to, empower the local people. Should that happen to you, please report immediately. Because should you first go home, you go and talk about it with your auntie or your husband or your what? Tomorrow, should you come back to this facility to report, they'll say, that is a lie. Or else you'll come at a time when this person who asked for something from you is not on duty. The only thing here is to empower them to know their rights. That if I come to this place, I'm supposed to get ABCD. Unless if it is out of stock, that we do understand. But having it there, is things like gloves. How do you send poor people to go that you bring gloves first? What happens to national medical stores? Why are they not producing those gloves? What went wrong? You see, even Ministry of Health does a lot. You see, they send things, they say, we are sending, they have everybody now, especially in the security system. They are the Obapisos, the Gisos, the whatevers, they call them so's. Those people are there to, to follow up these, they follow up government programs, including this.
Mothers here are also keen to share their experiences with us.
If you are sick, you go to these people. The first thing they ask you, do you come with your sister? Do you know the sister they are asking for? Is money.
Another word to our vocabulary, sister. Sister meaning the money to pay off the medical workers.
If you don't have money, they will tell you, we are not going to work on you. Go and bring your sister first. You think we work here, who's going to pay us? They don't even appreciate that they were being paid by government, but they still ask for money from these sick patients.
Enough of the new words. It is incumbent for the powers to be reined in. Let's look for our sisters elsewhere. We hit the road to Moroto in the Karamoja region. The populace here is in abject poverty, with Uganda Bureau of Statistics indicating that 60% of the people here live under the poverty line. This has not exempted them from the long arm of corruption across the country.
First look at how much government has been sending vis-a-vis the poverty level and the levels of corruption. A year cannot go without Karamoja being associated with corruption. From OPM, billions of money. A lot of, actually, corruption scandals here. If you are to do forensic audits in all departments, almost all, if not everybody, might be associated with the corruption index.
Karamoja and Corruption Coalition is in the fight against corruption in this region. And in the line of service, they have had similar accusations against the health sector in the region.
People have been reporting that, for example, I was in the health unit, they charged me some money. I lost somebody and I had to pay money to get the dead body out of the mortuary in a government hospital. Even in Moroto Hospital here, if you go to the grassroots and ask people, there are people who are paying for the service. Really. So, don't look at only big millions, but yes, even if it is the 2,000 in a government hospital where I'm supposed to get a free service and I'm paying, that's also type of corruption, even if it is 500 shilling.
Dr. Ayubu Mukasa makes a huge accusation. Moroto Referral Hospital is eating off dead bodies. This is a new extreme. Our team heads to Moroto Regional Referral Hospital to verify these claims. We speak to several people who affirm their claims but feel insecure to speak to us on cameras. However, the hospital director is not afraid to speak to us.
In this place, I would say that if it is there, it's very minimal, because first of all, the people are very poor. The moment you start soliciting any bribe or something like that, they will report to you. They will report to me. And okay, there's maybe some issues here and there where somebody has picked a few coins here and there, but they report.
We can report to you indeed that the officers at the mortuary are eating off dead bodies.
Yes, one of the monitor reported that he lost someone and the dead body was taken in the mortuary. And at the end, and then he had to pay to retrieve the dead body. So we had a district interpretation forum, and when Uganda verified, it came out. But this is one person. If we go to other hospitals, other Kabong, Abim, where you will find the same issues. Because if one person is coming, and this monitor was a victim, he himself had to pay this.
No, that one doesn't happen here. That one, at least, there is nothing like that. You'll even ask them, those people there in the mortuary, whatever. Only thing is that, actually, our mortuary is just, for lack of another word, but it's not what we call a mortuary. It's not a deserving mortuary for any person to be put